The beauty scientists, Dr. Christy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome back. I'm Dr. Christy Hamilton, board certified plastic surgeon, here with my fellow board certified plastic surgeon, Dr. Roy Kim, and together we are the beauty scientists. And we have an exciting episode today. We're talking about Dr. Kim's recent meetup at one of the facial plastic surgery meetings, and that's always interesting to see. Colleagues, they're not the same as board certified plastic surgeons or board certified facial plastic surgeons, and learn about what they're talking about. So why did you decide to go to this meeting? What was kind of piquing your interest?
I was actually invited. So one of my good friends, Dr. K Durey-Raj, is a facial plastic surgeon. And so she invited me to talk about some stuff. And this is the very first facial plastic surgery meeting I've ever been to. So it was a lot of fun.
That sounds wonderful. And I'm not surprised that they invited you. You've got so many innovative ideas and beautiful results. So why do you think it was the first time you've gone to a facial plastics meeting? I've never been to one either.
Yeah, I think it's because both societies are sort of frenemies. So in other words, for those out there who really don't know the rivalry, we're plastic surgeons, Dr. Hamilton and I. So in other words, the traditional way of doing it is learning about general surgery, which is ICU care, intestines, trauma care, all that stuff, and then going into plastic surgery. And that is by far the most common way to go. There is a different way. So specifically, you can major or do training after med school in ENT/otolaryngology, and then do additional training in facial plastic surgery. So their training is very focused on the face and head and neck. And so essentially it's like head and neck cancer and hearing and ears, as well as cosmetic stuff of the neck and the face. They specialize in it. And there has been a rivalry for 100 plus years. But to be honest, most ENT/otorhinolaryngology surgeons don't go into aesthetic facial plastics. Only a subgroup do. So throwing all that aside, I mean, if you're a good surgeon, you're a good surgeon. But this is why they don't really go to our conferences a lot, and we don't go to their conferences a lot. So it was a big honor to actually speak with them, meet some people who I've never met but follow on social media.
And can I ask, so what were you talking about? What did they invite you to speak on?
So the two things I talked about were practical ways to use AI in aesthetic surgery, and also how to melt calcium hydroxyapatite, also known as CAHA or Radiesse.
Yes, so you've helped me with that before. So for the viewers out there, so Radiesse biostimulator, when placed appropriately, it's great. It can be used to augment jaw lines. It can also be injected more dilutely as a biostimulator for collagen induction, make your skin glowy. But a side effect can be these nodules. So how do you go about treating patients who may develop those?
Yeah, so essentially from the dermatology literature, you can actually melt calcium deposits. And so the dermatology skin condition is called calcinosis. It occurs in lots of different people, certain skin conditions or medical conditions. So they have a chemical, it says STS, sodium thiosulfate, which actually helps with calcinosis with dermatology patients. And since calcium hydroxyapatite is a form of calcium, it actually works. Now, there are some little tricks or tweaks or hacks involved with it, and it doesn't melt as quickly as when we melt HA, hyaluronic acid, with hyaluronidase. It's not that rapid. So, but it does work. And especially in patients who really have a difficult nodule and the normal way of diluting it doesn't seem to help, melting it does work.
Amazing. And I know we should probably do a follow-up episode all on AI, because you are the guru of always bringing technology to plastic surgery and the practice and the actual practice of medicine.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.